If you're turning 65 soon or already on Medicare and you've done any research on Medigap plans, you've probably seen some of the unusual Medicare supplements listed on Medicare.gov. You may even start to get frustrated because it's hard to find clear information about those lesser-known plans like K, L, and M. Or you need information on your parents' discontinued plans like E, H, I, and J. In this video, we're going to be breaking down every single Medicare supplement plan, including the rare and oddball ones that most people have never heard of. And who knows, one of these lesser-known plans might actually fit your healthcare needs and budget better than the popular options that everyone talks about. My name's Hannah Skinner. I'm a licensed insurance agent at the Senior Savings Network, and by the end of this video, you'll know the difference between every single Medigap plan, which plans are only available to certain people, which plans are most popular today and why, which plans tend to have lower or higher rate increases over time, and which plans fit your personal healthcare and financial goals. Let's get started. First, let's quickly explain what a Medigap plan is. A Medigap plan, also called a Medicare supplement plan, works alongside Original Medicare Parts A and B. One of the biggest reasons that people choose a Medicare supplement is because it gives them the freedom to use virtually any doctor or hospital in the country that accepts Medicare without dealing with provider networks or prior authorization, two of the biggest complaints people have about Medicare Advantage plans. Original Medicare generally covers about 80% of approved medically necessary healthcare costs. That means you're responsible for the remaining 20%, deductibles, copays, and other coverage gaps. And that's where a Medigap plan comes in. As the name suggests, Medicare supplement plans are designed to fill the gaps left behind by Original Medicare. And because Medigap plans are standardized by the federal government, a Plan G from one insurance company has the exact same medical benefits as a Plan G from another company. The real difference between plans are the companies that offer them, monthly premiums, customer service, claims processing speed, financial stability, and the size of the company's Medigap pool, which can affect future rate increases. Most people don't realize that Medicare supplement companies do occasionally leave the market or stop offering plans. That's why at Senior Savings Network, we generally recommend larger, financially stable companies with a strong history in Medicare. There are currently 12 standardized Medigap plans available in 47 states. Those plans are A, B, C, D, F, G, K, L, M, N, plus high deductible F and high deductible G. Wisconsin, Massachusetts, and Minnesota all have their own state-standardized Medigap systems. There are also older plans, E, H, I, and J, which were discontinued for new sales in 2010, though some people still have them today. Now let's break down every Medicare supplement plan in detail. You almost have to start with Plan F because it's the foundation for understanding other Medigap plans. Understanding the structure of Plan F will help you understand all other plans. Plan F is the legendary full coverage Medicare supplement plan. In fact, it was considered so comprehensive that the federal government stopped offering it to people newly eligible for Medicare after January 1st of 2020. To qualify for Plan F today, you must have been eligible for Medicare either due to age or disability before 2020, even if you didn't enroll yet. So this plan is still available, but only for some people. Plan F covers all of Medicare's major gaps, including the Part A hospital deductible, the Part A hospital copays, the Part B deductible, the Part B 20% coinsurance, skilled nursing facility copays, Part B excess charges, and foreign travel emergency coverage. The Part B deductible in 2026 is $283, and Plan F pays that in full. Now, that's important because federal law now prohibits newly eligible Medicare beneficiaries from enrolling in any Medigap plan that covers the Part B deductible. One of the biggest gaps in Original Medicare is the unlimited 20% Part B coinsurance. For example, a $100,000 outpatient surgery bill could leave you owing $20,000 on just Original Medicare. A $1 million cancer treatment bill could leave you owing up to $200,000. Plan F eliminates any of those costs entirely for Medicare-approved services. So with Plan F, if Medicare approves the service, you pay nothing except your monthly premium. That's why Plan F remains very popular among people who are in their 70s and 80s. Plan F is the guaranteed issue plan for those who are eligible for Medicare before 2020, such as those losing Medicare Advantage coverage over the age of 71. This causes the rate increases on Plan F to be very high. Frankly, the risk pool is smaller, older, and sicker, so more claims are filed and shared among fewer people, which means higher rates for everyone. There's also a high deductible Plan F option. In 2026, the deductible is $2,950. Until you meet the deductible, the plan works similarly to original Medicare. After that, it functions like a regular Plan F. However, most people today prefer the high deductible Plan G because it generally offers better value. It's less expensive for practically the same coverage. We'll talk about high deductible G more later in this video. Now let's go to the rarely discussed Medigap Plan C. An important note is this is Medigap Plan C, not Medicare Part C, which is Medicare Advantage. Many people don't even realize that Medigap Plan C exists, so it's important to speak with an agent who specializes in Medicare supplements, or you might end up getting shown Part C Advantage plans. Like the Plan F, Plan C is only available to people who are eligible for Medicare before 2020 because it covers the Part B deductible. Plan C covers almost everything that Plan F covers except the Part B excess charges. So if your doctors accept Medicare assignment, you'll pay virtually nothing out of pocket for Medicare-approved services. Plan C covers the Part A deductible, Part A hospital copays, skilled nursing facility copays, the Part B deductible, the Part B coinsurance, and foreign travel emergency coverage. Because it does not cover excess charges, premiums are slightly lower than Plan F. However, Plan C is much less common and not offered by every insurance company, which means that the rate increases can be higher due to a smaller and older pool. You would also need to speak with an agent who works with multiple carriers, since it's only offered by a few companies. Plan C is also a guaranteed issue plan for people who lose coverage, such as Medicare Advantage. Next up is Plan G. Plan G is currently the most popular Medicare supplement plan for new Medicare beneficiaries. It's available to everyone enrolling in Medicare today and is also guaranteed issue. So if you were eligible for Medicare after January 1st, 2020, Plan G is your guaranteed issue plan. Plan G works almost exactly like Plan F except for one difference. It doesn't cover the Part B deductible. Again, in 2026, that deductible is $283 annually. After you pay it once each year, Plan G covers all other remaining Medicare Part A and B costs. That's why many people love Plan G. No networks, no referrals, no prior authorizations, and predictable healthcare cost. Plan G is especially popular with people turning 65, frequent travelers, individuals with ongoing health conditions, and people who want the maximum coverage available today. Typical premiums range from about $120 a month up to $250 per month, depending on age, tobacco use, zip code, and the insurance company that you choose. One downside is that Plan G often experiences higher rate increases over time because it's also a guaranteed issue plan. If you really like your Plan G but want to see if you could pay less, you can call us to help you shop for another less expensive Plan G in your area. There are likely savings, especially if you can answer a few basic health questions. Remember, a Plan G has the same coverage no matter which company that you choose. Now let's discuss another lesser-known Medicare supplement plan, Medigap Plan D. And no, this isn't Medicare Part D prescription drug coverage. Plan D covers almost everything that Plan G covers on Parts A and B, except the Part B excess charges. Plan D is often attractive to people who want strong coverage, lower premiums than a Plan G, and are comfortable using doctors who accept Medicare assignment, which is the Medicare-approved payment amount. Plan D is also a guaranteed issue plan for people who are eligible for Medicare after January 1st of 2020. Now for my personal favorite, Plan N. Plan N has exploded in popularity in the last few years because it balances lower premiums, stronger coverage, and lower long-term rate increases. Plan N covers the Part A hospital deductible and hospital copays, skilled nursing facility copays, foreign travel emergency coverage, and the Part B 20% coinsurance. But you do have some small copays for Part B. You have up to a $20 copay for office visits, although wellness visits are $0, just like with original Medicare, and up to $50 for an emergency room visit. Plan N also does not cover the Part B excess charges, which again is the overage amount that providers can charge if they don't accept Medicare assignment. This is capped at 15% of the Medicare approved amount. Plan N is best for people who don't visit the doctor more than 20 times a year, people wanting lower premiums than Plan G, and those concerned about future rate increases. Typical Plan N premiums range from about $80 up to $200 a month. And unlike Medicare Advantage plans, you still keep the flexibility of original Medicare. Plan N is not a guaranteed issue plan, so you must go through underwriting to get on this plan if you don't join at 65 or when you first start Medicare. If you're getting high rate increases on your Plan F or Plan G, and you don't feel like you go to the doctor very often, you should give us a call and see if you're able to switch to Plan N. You can change Medicare supplements any time of the year. You don't have to wait till the annual election period in October to see if you can save money on your Medicare supplement. Now on to Medigap Plan M. Plan M is a middle ground plan. It's very rare and only offered by a few insurance companies. It usually appeals to people wanting lower premiums but who are willing to share some of the hospitalization cost. Plan M covers 50% of the Part A hospital deductible, hospital copays, and skilled nursing facility copays. And it also covers the 20% coinsurance for Part B. It does not cover the Part B deductible or Part B excess charges. Plan M only covers 50% of the hospital deductible for Part A. It does cover hospital copays and skilled nursing facility copays, and the 20% Part B coinsurance. It doesn't, however, cover the Part B deductible or Part B excess charges. And unlike Plan N, there are no office visit copays. So if you prefer to not have doctor's copays but are okay with a $900 hospital bill, then this plan might be a good option for you. Now, Plan M and Plan N typically have similar premiums. So for most people, it's more cost-effective to go with the Plan N. Plan M can also be paired with the hospital indemnity plan to cover the Part A deductible if you want those doctor visits covered but don't want the hospital expense. Next is Plan L. Plan L is one of the least discussed Medicare supplement plans, but it can actually be a hidden gem for some consumers. Think of Plan L as sharing cost with Medicare while still providing strong protection. Plan L pays 75% of your Part A cost before you hit the maximum out-of-pocket. So for your Part A hospital deductible, instead of $1,736, you would only pay $434, and your Plan L would pay the other $1,302. For Part B, it's a 𝗫𝗫𝗃 cost share. For example, Medicare pays 80%. The Plan L would pay 15%. So that leaves you with a 5% cost share. So on a $1,000 MRI, you would only pay about $50. If you had a $300 specialist visit, on the Plan L, your cost would only be about $15. In 2026, the Plan L has a $4,000 maximum out-of-pocket, but this changes every year. The maximum out-of-pocket is important because once you hit that limit, the plan pays 100% of the covered cost for the rest of the year. Plan L is attractive for people who want lower premiums, want a defined maximum out-of-pocket, and still want the freedom of original Medicare without networks or prior authorizations. Premiums can start around $90 a month for the Plan L. Plan K is designed to have lower monthly premiums, but in exchange, you'll share more medical expenses. On Part A, Plan K pays half of the Part A deductible, so you pay the other half. So in 2026, if you are hospitalized Instead of $1,736, you would pay half of that cost, which is $868 for up to 60 days in the hospital, and then Plan K would pay the other half. On this plan, you have a 90-10 cost share for Medicare Part B. For example, Medicare pays 80%, Plan K pays 10%, so that leaves you with a 10% cost share. So a $1,000 MRI would cost you around $100. Plan K also has a maximum out-of-pocket. In 2026, that maximum is $8,000. This is much higher than when Plan K was originally released, so it's far less attractive than it was originally. Once you hit the maximum out-of-pocket, the plan pays 100% for the rest of the year. But Plan K does not cover Part B excess charges or foreign travel emergency coverage. Today, many people prefer the high deductible Plan G or the Plan N instead because they offer stronger overall value. The typical monthly premium for Plan K is between $70 to $150 a month. Plan K is designed for healthy retirees and budget-focused individuals. But there are likely other Medicare supplements that would better meet your needs. So at this time, we almost never recommend Plan K. Now we have Medigap Plan B. Plan B is often confused with Part B. Plan B is not very comprehensive as it only covers two of your medical expenses, the Part A hospital deductible and the Part B 20% coinsurance. It does not cover skilled nursing facility copays, the Part B deductible, or excess charges. Skilled nursing facility coverage is extremely important because 100 days in skilled nursing could cost over $17,000. Skilled nursing is where you would go for inpatient rehabilitation after things like a stroke. Because of those gaps, we rarely recommend the Plan B today. The Plan B typically ranges between $100 to $180 a month, and it's also not sold by many insurance companies. Plan B is, however, guaranteed issue for all Medicare beneficiaries that lose their coverage at no fault of their own. Now we have Medigap Plan A. Plan A is the least comprehensive Medicare supplement plan. Federal law requires every company selling Medigap plans to offer a Plan A, and it's guaranteed issue for people who lose their plans involuntarily. It only covers the Part B 20% coinsurance and limited hospice and blood benefits. It does not cover the hospital deductible or copays, skilled nursing facility copays, the Part B deductible, excess charges, or foreign travel emergency coverage. That means beneficiaries remain exposed to a potentially very large hospital and skilled nursing facility cost. Plan A is generally not recommended today except in a few unique situations, particularly for some disabled beneficiaries under 65 in certain states. Some older people still have this plan and could be stuck on it due to health conditions. That's why it's important to still understand it. Being fully exposed to Part A costs like hospital deductibles and skilled nursing facilities could leave you paying over $27,000 a year. So if you're stuck in a Plan A, call today to see if you could be enrolled in a hospital indemnity program that's guaranteed issue. Now we have high deductible Plan G. As we mentioned earlier, the high deductible Plan G has become increasingly popular. In 2026, the maximum out-of-pocket is $2,950. After you meet that amount, the plan functions like a regular Plan G. Advantages include very low monthly premiums, no provider networks, no prior authorizations, and lower long-term rate increases. The downside is that you must be financially comfortable covering the deductible yourself. Many people pair a high deductible G with a hospital indemnity, cancer, or critical illness plan to offset worst-case scenarios. For those with high premiums who want to keep original Medicare, but want lower premiums and more shared cost, this plan is a great alternative to Medicare Advantage. This plan is not guaranteed issue, so it has very minimal rate increases. The high deductible G typically runs between $40 to $80 a month in most areas. If you'd like to learn more about the high deductible G plan, we do have a video on this topic. Click here to watch the video. Now finally on to the discontinued plans. The federal government discontinued plans E, H, I, and J in 2010 after the Medicare Part D prescription drug laws changed. You can think of Plan J as a super Plan F. It covered everything and included excess charge coverage, foreign travel emergency coverage, home recovery benefits, and limited prescription drug coverage. Plan H is similar to Plan C, but with limited drug coverage and home recovery benefits, but Part B excess charges were not covered. Plans E and I were more similar to Plan G, but they did not cover the Part B deductible, and added home recovery benefits. Plan E had no prescription benefit, but Plan I did. Some seniors who kept these legacy plans never enrolled in Part D prescription coverage and now face significant late enrollment penalties and high drug cost. So if you or your parent is on one of these plans and never enrolled in Part D, you could be facing hundreds of dollars a month in late enrollment penalties if they enroll in Part D or a Medicare Advantage plan with drug coverage now. In some cases, switching to a newer Medigap plan or Medicare Advantage plan may make financial sense, but again, beware of the drug coverage. So now that we know everything about all the Medigap plans, who can enroll and when? To enroll in a Medigap plan, you must be enrolled in Medicare Part A and Part B. The best time to buy a Medigap plan is during your Medigap open enrollment period. This is the 13-month window that begins when you are turning 65 or retiring and enrolling in Part B. In most states, it starts 6 months before your Part B effective date, lasts the month of your Part B effective date, and 6 months after your Part B effective date. During this period, you cannot be denied coverage and companies cannot charge more for pre-existing health conditions. After that period, you must be medically underwritten to get a plan in most states. Now, your premiums for these plans depend on age, zip code, gender, tobacco usage, the insurance company, and household discounts. One company may charge $120 for a Plan G, while another company charges $220 for the exact same coverage. This is why we stress shopping your plan every single year, because you might have some savings out there. Hopefully this video helped make all of the wild, wacky, and wonderful Medigap plans a little less confusing. If it did, make sure to like this video, subscribe to our channel, and share it with someone researching Medicare. And if you'd like help comparing Medicare supplement plans in your area, give us a call at the number below. Thanks for watching, and we'll see you in the next video.